Let's talk about disseminated intravascular coagulation. This is where the body is bleeding and clotting off at the same time. Very dangerous situation where the triggering event is usually caused by severe infection like sepsis, especially gram-negative bacteria, trauma, burns, shock, malignancy, especially leukemias, obstetric complications like placental abruption, amniotic fluid embolisms, massive transfusions, liver failure, and surprisingly snake venom. So this is a systemic inflammatory coagulant response. You're going to have inflammatory cytokine surge like interleukin 1 and 2 necrosis factor alpha, along with tissue factor TF is released. This activates the intrinsic clotting cascade and thrombin production skyrockets. You're going to have widespread microvascular clotting where fibrin deposition throughout capillaries, and then platelets are consumed in huge numbers, and then formation of microthrombi or little tiny clots, and this is going to block very small vessels. These very small clots or microthrombi choke blood flow, so they start accumulating in these small vessels and then they grow and grow and grow, and then this leads to tissue hypoxia, and then organs begin to fail like kidneys, lungs, liver, brain. So patients may show confusion, oliguria, or cyanosis. That's going to lead to consumption of coagulation factors. Platelets, fibrinogen, clotting factors, especially 5 and 8, are depleted. And then you're going to have natural anticoagulants like protein C, protein S, and antithrombin. They're going to be overwhelmed. Next is activation of fibrinolysis. So plasmin breaks down clots, and then this fibrin degradation products, or FDPs, along with D-dimer, these are going to flood the bloodstream, and these FDPs themselves act as anticoagulants, and so you're going to have worsened bleeding tendencies. And this is where the crazy part happens. So you're going to have this thing called bleeding diathesis, where the patient swings from clotting to uncontrolled bleeding because they consumed all these clotting factors. So they're going to be oozing from IV sites. They're going to have mucosal bleeding, petechiae, ecchymosis, severe hemorrhage is possible, especially in the GI tract and the lung. So the full-blown picture is going to look like microvascular thrombosis, massive bleeding coexist, shock from hypoperfusion and bleeding, multi-organ failure, increased mortality if untreated. So we're going to treat the underlying factor or the offending factor. So in summary, or in short, you're going to have a triggering event like sepsis. This is going to cause a thrombin storm, which is going to lead to microthrombi, which is going to lead to organ ischemia, and then factor depletion of those clotting factors, fibrinolysis, and then bleeding everywhere, and then shock and organ failure. Hope that helped. Follow along for more, and let me know if you have any comments in the comments.